So, yes, this is a session where I'm just going to... Oh, is it not on? Oh, sorry, I've just worked out my camera's not on. If I can find myself, then I can turn my camera on. Oh. Is that working now, Leanne?
Yes, it's on now.
Great, okay. Yes, this information session is just to give you all a bit of a briefing on what's in the Sector Sustainability Knowledge Hub. That's a web page that's being hosted by ACOS, and it collates material that was developed through the Sector Sustainability Project that ran from July 2023 to December 2024. Yes, so I'm going to give a bit of a recap on the Sector Sustainability Project, give you a presentation on the Knowledge Hub and some other resources that are available to support work on NGO sustainability. Then we'll have some time for some Q&A, and I'd be really keen to hear about any feedback on how people think this material might be useful. So the Sector Sustainability Program was announced by the ACT government in early 2023 and was intended to run for 5 years. And the Sector Sustainability Project was the first sort of 18 months of that program and was designed to sort of scope and do some initial work on sector sustainability. The first, there are 3 sort of policy agendas that were being progressed through the program. The adoption of commissioning as a way of ACT government partnering with NGOs to fund human services. Following up on the counting the cost recommendations that were really about breaking the starvation cycle for NGOs, and also using the ACT Wellbeing Framework to guide investment in human services. The intention of these 3 policy agendas was to build a sustainable partnership between ACT government and community-based organisations. And so that's the kind of policy framework for this work. So just reminding you, this is the commissioning for human services that is framing the 10-year human services reform agenda, and the Sector Sustainability Project was sort of co-occurring with that 2022 to 2024 stage of commissioning. As I mentioned, the not-for-profit starvation cycle was a really key conceptual framework for this project, which, if you haven't heard me speak about it before or other people speak about it, is the cycle of funders and the public expecting not-for-profits to have low overheads, which then leads to not-for-profits under-allocating and under-reporting on their overheads, and in fact cross-subsidising overhead expenses. 2 documents there. One was the and then funders are in a position over many decades of that non-profit starvation cycle, sort of having plausible deniability around what it actually costs to fully fund organisations. The key learning from the key issue in that not-for-profit starvation cycle is that it's generated a long-term destabilising trend of underinvestment in organisations, and you can see the links here I have to research that has underpinned this finding. And the key areas of underinvestment are very similar to the areas of underinvestment found in the Counting the Costs report that ACOS did, which are about human resources management, information and communications technology, fundraising and business development, safeguarding everything from safeguarding for the safety of people accessing services as well as work health and safety, and ensuring you've got the right premises to do your work and you can afford to continue to maintain those premises. Through the project, we also looked at an acceleration and escalation of the starvation cycle. So the COVID-19 pandemic, of which you're all familiar with, the workforce and working capital supply gaps that occurred through then and are still playing out. The increased risk profile and the cost of mitigating those risks that went up, largely driven by insurance companies having much more call on their funds, which meant they had to increase the premiums to continue to meet those calls on their funds, largely around extreme weather events. And then the ongoing demand growth, which was driven by both population growth and diversification. So a growing diversity of population in Canberra, but also population growth way above what had been anticipated in the 2016 to 2021 period. The 2021 census showed a much higher growth of population than had been anticipated prior to that. The cost of living crisis and the increased complexity of needs. So yes, the Counting the Costs report recommendations ended up sort of being a really key focus for the work of the Sector Sustainability Project, and there were 6 recommendations which I kind of grouped into 3 areas. I also thought it was worth just referring here to the definition and the purpose of the wellbeing framework, because ACT government had said in launching that framework and in funding the Sector Sustainability Program that addressing wellbeing outcomes was sort of the core focus for investment. I'm not sure we've actually seen that play out in the way the investment has happened, but it's kind of worth seeing how they framed it. And I was hoping that this kind of slide would be useful for holding the government to account on that. We kind of developed a theory of change in the Sector Sustainability Program around how NGOs play a role in strengthening wellbeing. So what are the links between wellbeing domains and human services? And then if we understand those and invest in those, then what will happen? Because we've been investing appropriately and addressing the drivers of disadvantage, vulnerability and deprivation. So the Knowledge Hub was part of the proposal that Capital Region Community Services put to ACT government when they pitched to be the host organisation for the Sector Sustainability Program work. And the reason why we did that was we were very conscious that often ACT government has funded and done some useful work around policy and sector development, but then there's the material that has developed through that work and the insights and the resources that were developed get lost in the mists of time. So the intention of this Knowledge Hub was to make sure that materials that were developed through the project are available for ongoing access to the public, and can support ongoing advocacy and policy development. If you want to just read one document, I'd recommend you have a look at the final report, which is up, which basically summarises the work of the project, the key lessons learned, and the and where the policy agenda got to through the ACT election the commitments made in the ACT election in 2024 and the negotiations to form government with the Independents and the ACT Greens. You can see kind of the whole picture there. And what I will be going through now is the more detailed material that is available in the Knowledge Hub. But if you have limited time, then that sort of final report is a good place to have a look. And there's information about everything that's in the Knowledge Hub in that final report. So the Knowledge Hub is hosted by ACTCOS, and it is a page that's embedded in the ACTCOS website. It's organised around this list of contents. So when you go into the Knowledge Hub, there's you can click on each of the sort of chapters, and then it'll list below what's in that chapter. I'm going to do a bit of a highlight today what's in each of those chapters. But I'm not focusing very much on the policy advice and the presentations. I'm focusing more on the tools and resources that have been incorporated into the Knowledge Hub. I would note that a lot of the material in the Knowledge Hub is not material that the government has accepted. It is material that was developed based on the consultations and dialogue with NGOs. Where a document had been accepted by the government, it's a formal report, and that will be evident when you look at the materials. Where the material was developed through the project but not formally accepted by government, it's listed as such in the document. So if we think first about commissioning as the policy, one of the policy agendas that the sector sustainability program was progressing, a number of really key insights and key questions came up through consultations. And it was these sorts of questions that were guiding the kind of materials that we developed. First of all, Fiona May, who was the government co-lead on this project, and I did some work inside government in the first 6 months of the project on thinking through what could be some standardised questions for procurement activities and how might government streamline procurement of human services. The other thing that we did that thought was useful to make visible to you is I provided a presentation to Community Services Directorate on the concept of stewardship. You might note that the Australian Public Service has added the value of stewardship to the Australian Public Service Commission values. And it's a concept that has been spoken about more broadly in places like the World Health Organization around how do organizations and governments that are funding service systems do that in a way that is cohesive, comprehensive, and with a mind to the long-term value proposition of those services to the people who are the intended beneficiaries of them, rather than thinking about short-term and funder return on investment. So I think that there's actually one of the insights I had coming out of this sector sustainability project was the lack of stewardship and the lack of understanding of that concept and adoption of that concept as funders is probably been one of the barriers to a sustainable and effective funding arrangement. So I thought it was useful to just share some material on that. The other material relevant to commissioning is some work I pulled together based on some research that had been done in the US around the human services value curve. Also pulled together some good practice and evidence around how to define and assess value for money in human services, which isn't inconsistent with the more generic ACT government procurement requirements, but it's about an extension of that is relevant to human services. So the sort of presenting the procurement guidelines as foundation, sort of as a necessary foundation, but not sufficient for getting really good value for money in human services. I also did an analysis of if the ACT government really wants to go to an impact investing model, what does the research research say around what's needed to do good impact investing, and where is the ACT government at in terms of its current commissioning processes, and what does it need to grow and build to really deliver on an impact investing model. And then the final thing I've mentioned there is the compendium of ACT government legislation, regulation, policies and guidelines. What I wanted to do was to pull together actually what the ACT government has said it will do, and what is the legislative and policy framework that underpins how funders work with funded organisations, and what the contractual requirements and management processes are. My intention there was to make sure that everybody had the same information, because often contract managers in NGOs and in government have a different view on what is being expected of each other, and I thought this compendium could be quite helpful for ensuring more consistency and transparency in those expectations of each party. The next two recommendations from the Counting the Costs report that I want to focus on is adequate indexation and funding efficiencies. There were three key things that came up when thinking about adequate indexation. One was the cumulative impact of inadequate indexation. The other was that CPI and WPI, wage price index, are not an appropriate baseline for indexation, and that indexation does nothing. All it does is it provides some percentage increase on baseline funding. It doesn't enable growth of services. And the reason why I thought it's important to make that really visible is government often says, oh, we've increased funding by $8 million over 10 years. But the reality is it's not an increase in funding. It's a provision of CPI increases, not an increase in baseline funding. And yeah, that's often a bit invisible in the public commentary. So we pulled together material that was available from a whole lot of other sources around indexation, including the work that had been done in ATCOS around the cumulative gap that had emerged by 2019. Some work in Tasmania, Queensland and WA by the COSs in those jurisdictions, and work by the University of Western Australia on why the WPI and CPI aren't the appropriate basis. So really, these are just resources for people to use to maybe inform your boards, to inform your advocacy work, and to contribute to the broader, and so that you can understand what the work in the ACT is contributing to in terms of the broader agenda around fixing indexation. In terms of efficiencies in funding arrangements, people provided an enormous amount of valuable ideas around how to improve funding efficiency. This was a real focus early on in the project, because this is a place where particularly government funders think, oh, if we could get more efficient, then maybe we don't need more resources. And what the project found was that there are some very practical things that could be done. And there was this listening report was a formal report adopted by government around how those funding efficiencies could be implemented. And I would really draw your attention to this and invite you to continue to present this kind of information back to government, because the government did accept this report as a way forward. To what extent it's being progressed is not visible to me at the moment. The other thing is I did do another compendium, which was what has the government said is important for a sustainable relationship. So separate to its the current sort of legislative, regulatory, policy and contract requirements, what has the government said around what they think a sustainable relationship is and how that might be achieved. Again, as a way of feeding back to government, this is what you've already said about these things. Where are we at in terms of progressing them? So the next couple of recommendations I want to focus on are the ones around fully costing human services. And that also includes improving sort of the capability of both NGOs and government to understand what fully funded services, how to calculate what it takes to fully fund services. There were 3 issues that came up in my consultations with people, and they're described in a fair bit of detail here, but really it was about how do you categorise direct and indirect costs, how do you assess value for money, and how do you properly manage shared risks rather than funders putting the costs of risks onto providers and not properly sharing those risks in long-term funding arrangements. The formal report on this that was adopted by government is this October 2023 summary report, and you can see there the way the consultation happened and how it landed where it landed. In terms of categorising costs, there are 3 resources in the Knowledge Hub that I'm hoping will be useful. The background paper that was written for some workshops, a listening report from workshops that were held, and then a more detailed briefing on how that evidence might inform procurement procedures. The other thing I've just noted here, which is ongoing, is the work by the University of Western Australia that is continuing with ACT government on developing a costing tool and resource that can be used by both funders and providers. But that material will be uploaded to the Knowledge Hub when it's ready. But Fiona May is the key contact on that for what the status is just now. As I said before, defining and assessing value for money was a sort of key focus of the project because people had talked about how the current procurement guidelines are a bit shallow. They're the baseline for any kind of government procurement, from buying paper to purchasing a building to, constructing a road to delivering a human service. And so what we thought was important to do was to sort of think through what needs to be done in addition to the baseline work. So that material is in these 2 papers. Again, sharing risks, I've already spoken a bit about that. Particularly, I draw your attention to the background briefing paper, provided a whole bunch of information about what the evidence base is that would support a better sharing of risk in partnerships between funders and NGOs. And then the October 2024 briefing sort of put together a bit of a template that I thought you might be able to use in the process of negotiating. Once you've been identified as the preferred tenderer, how might you sort of frame what the shared risks are in partnership with the funder, and how might you document how you've agreed you'll share those risks over time in the project as it rolls out, in the program as it rolls out. The third sort of area of recommendations in Counting the Costs report were about boosting funding to address unmet needs and reorienting funding to invest more in prevention. This was an area of the project that I think we really didn't make a lot of progress on, primarily because when we spoke with government about this and when we worked with government on doing some initial mapping, the key finding from government was that within their current infrastructure, including their, the way they organise contracting teams and in the ICT software that they use, and in terms of resourcing of data collection, analysis, and ongoing development, it's actually not possible to make use of the data that's being collected in any sort of systematic and more kind of impact investing way. This is so disappointing, and I actually think this needs to be a really key focus for work in the future, which all of the people that I spoke to in NGOs around this, and in fact a lot of people I spoke with in government as well, the ongoing frustration with the lack of capacity to use data well is really profound. And there is a real issue around collecting data in ways that it can't be used to inform future decision making. So I'm not telling any of you something you didn't already know, but what I would say is that I did pull together some work, and it's a bit rough, but I thought, look, I'll put it out there anyway, which is just to sort of try to conceptualize what NGOs are doing and how what they're doing could be conceptualized differently based on, research and frameworks that have been published in the literature, and how might we think about collecting data differently and using data differently into the future. The other thing I included in this resource was sort of some work that I developed largely through input from Robin Martin from Beryl and Ruth Jallow at Capital Region Community Services, where I tried to conceptualise why working with people in the priority groups is different to working with the general population. So in this resource, I've kind of done this series of tables. One is green, one is orange, one is red, where we look at, for the general population who have generally good well-being, when they need to access services, what's the foundation in terms of their own well-being and their own resources that are supporting them alongside the more specialist service provision. For people in the orange zone, they're people that might have some vulnerabilities or risk factors and less access to wellbeing resources, and how that plays out in terms of the way services need to be offered. And then in the red zone, the people who have multiple and enduring barriers to wellbeing, and in fact really limited wellbeing resources within which they can draw on when they're facing adversity, and how that plays out in terms of the kinds of demands that are on services and the different ways that service need to be delivered to actually be effective for that group. So anyway, as I say, it's not fully formed thinking, but I thought it's useful to pull together the material that I identified through the consultations and through some really good insights that were shared by people in the project, but also what's in the literature around how to do data differently. The other thing that we did just at the end of the project was to say, well, if we haven't got good data from service delivery in the ACT, there is quite a lot of good data out there, and this is a list of some of the material that was available at the end of last year that does provide some useful data around unmet need and the need to invest more in prevention. And then this is my final slide before we go to questions and feedback. And what I wanted to say was the sector sustainability project was done in the context of a whole lot of work that's being done all across Australia, and in fact around the world, around the problem of inadequate and not well managed funding arrangements with NGOs to address the social, environmental and human capital issues that we all think are really important to attend to. But what I've included here is the work that's underway in Australia, including work by ACCOS on the Act for Community campaign, work by ACOS around Commonwealth funding arrangements, and including the not-for-profit sector development blueprint that was published at the end of last year. The ACOS have also done some work in the lead up to the federal election and put some really clear information together around how to improve the fairness of funding for frontline services. The University of WA did a webinar just earlier in April, and it's a really good sort of half-hour summary of where they've come to in terms of the findings from their research on sustainability of human services funding. And I also wanted to flag the Pay What It Takes Coalition. They've got a website that, as you can see there, the sort of the contents list on their website, but they've developed a whole bunch of resources that they hope are useful for NGOs who are trying to talk differently to government around what's needed in funding and how funding for both direct and indirect costs delivers impact for the communities for which organisations exist. So, questions and feedback, welcome. And I might just stop sharing this because I can't see anybody whilst I'm sharing this and it's a little bit odd. So, questions and feedback from everyone.
Okay, it sounds like no one has any questions.
So I have a question for people. Given and you might just want to go onto the website, you can kind of open it and have a look at it. But given the material that you've just been very briefly talked through today, do you think any of it could be useful for your work inside your organisations or your work for advocacy? And I see Lisa's got a question, so go ahead, Lisa.
Thanks. Sorry, too many screens to move a mouse across. I don't necessarily have a question. It's more a comment, and it probably answers the question you were just posing, which is that I actually think there are some really valuable documents up there, and I haven't gone through them all yet, but certainly looking at, and the one I was looking at this morning around the theory of change and the if, then what, I think is some really valuable information in it that we should be thinking about in terms of, as a sector, how we argue, firstly, our worth to community and population, secondly, our worth to funding in lots of ways. So whilst there might not be many questions, I guess I wanted to just acknowledge that the work is valuable. I have a sense of frustration that we didn't get further in terms of, I guess, increased funding commitments through the project, but that's not to do with the people involved in the project. I think it's to do with how we, and I think what's valuable for me, Susan, and what you've put together is that we need to create a different rhetoric for the same argument. We can't keep using the same argument because we're going to end up at the same spot each and every time. And what I think these documents give us is a way to form a new rhetoric around how we're arguing for our position in the world. So thank you for that.
I really value that that feedback, Lisa, because I think that was my sense as I got into the detail of the project, is that we did need a new rhetoric. So what I spent a fair bit of time on was kind of looking at the literature and looking at how things were being conceptualized in other contexts, and then trying to think about how we might use that in the ACT. So things like that, the concept of stewardship was one of the things I thought, if we could really land this, then that would make a difference. I think like you say, the stuff on how does the government understand how we fit into the wellbeing framework objectives, I thought was another area for some more work. And so I appreciate that you've had a look at some things, Lisa, and can see some things that might be useful. The other thing that I think might be potentially more practical, kind of short-term practical, is some of those resources around how do you talk about direct and indirect costs. So, and what really struck me is, if people happen to have a look at it, there's quite a short list of direct costs. There's a really long list of indirect costs. Now, the short list and long list isn't necessarily reflected in the allocation, because the short list is largely around, people and infrastructure to deliver services. So that's the majority of the money. But the long list of indirect service costs is actually also about how much brain space it takes up to be doing that long list of indirect activity well. So there's the resource on sharing risk, I hope, is kind of a practical resource that people can look at and go, okay, does this give me a different starting point for a conversation with a funder? And also looking at the assessing value for money, like how can we as an organisation talk about these values this value that we're bringing to to the work, and how might we articulate it in our funding proposal? Because I think often the services know exactly what value they're bringing, but it doesn't always come across in the way that it's read by the funder.
I couldn't agree more. I think it's also about how we use some of the documents and arguments in timely manners. So, for example, I think there's a really poignant conversation at the moment around shared risk off the back of the WorkSafe notices to the Canberra Hospital about home visits, and going, well, hang on a minute, if we're having to increase people and workers' safety from a hospital perspective, and that's meaning double visits, etc., then the same needs to apply to us in a shared risk model. So I think it's really about being attuned to what's happening in the government sector and how we need to bring some of the same rules and regulations or compliance and costing back into the community sector. The other thing, and then I'll shut up and let somebody else take the floor, that in the if then what, I think we also need to add a column. And if not, what else? Yeah, because I think that's the bit that we keep missing in a treasury sense, is if you don't pay me for early intervention to do these things, to achieve these outcomes, then what you will pay for is an acute presentation. Yep, or an ambulance visit or a whatever. So I think we need to put that alternate column on that table to go, if not, then what?
Well, Lisa, I give you permission to take those tables and improve them and use them, and in whatever, like that. This material it was publicly funded, so my view is it should be publicly available and used by whoever.
I think I'm going to take it to there's a coalition of peaks that meets. I think it'd be a useful piece of work for that group to do, to take that table and really expand upon it and really start thinking about it, because I think it then provides a good costing model as well, to go, well, the if not then what is a hospital bed at X amount of dollars, or is an ambulance at Y amount of dollars, or is a family breakdown at Z amount of dollars, or whatever the case may be. And I think if we can do that across the peaks, it becomes a really valuable argument.
Yep.
Okay, well, if no one else has any, Ruth has her hand up. Go on.
Hello, hi everybody. Susan, was there anything when you were leading this project that came out that maybe you weren't expecting or surprised you? Yeah, or that kind of came out of left field?
I wouldn't say that I was surprised, but I think what came up, which we didn't really have time to incorporate, was the work that was happening nationally through the blueprint, and the work that was happening through the resources that were being developed through the Pay What It Takes coalition. So I think those two pieces of work have got momentum and will continue to deliver. But that material wasn't, that stuff all came out in November, so it couldn't actually be used terribly fruitfully for the project. But I think it's really useful for people to keep in touch with those two pieces of work going forward.
Okay, great. Does anyone else have any questions before we wrap up?
So I should probably just say at the end that this project was done as I was hosted by Capital Region Community Service to do the project. So that's my first thank you. The second thank you is I worked really closely with Fiona May, who was the government co-lead, and I was the community co-lead. And Fiona was a really valuable colleague. She'd been a colleague in NGO world, and her strategic smarts and her integrity continued to impress me through the work that I did with her in the project. So big shout out to Fiona. She continues to be an ally for this work. And also big thank you to ATCOS, who were willing to host this Knowledge Hub for the next few years. And I really hope that everybody joins up to the ATCOS Act for Community campaign and continues to contribute to the research and analysis that ATCOS does, because that will be vital to progressing the objectives of sector sustainability.
Great, thanks, Susan. I just wanted to say thank you for providing everyone with that information on the Knowledge Hub. It's a very useful resource, and I hope that everyone is using it. So after this session, I will be sending out the link to the YouTube video of the training session and an evaluation for the info session. So please complete that. It takes less than a minute to complete, and it really helps with catering our information sessions. I also recommend that you register for our upcoming training opportunities in May. These include the cultural competency training, the Yuma cultural awareness training, and an information session on communicating impact with better data. So the information sessions are free, so I suggest that you register on our website. I think all those event details are just on our website, so you can just register that way. And yes, Bianca, I will be sending out the slides as well. And Susan, Hannah has just said thanks.
I've just responded. Yeah.
Okay, great.
Yeah, so Hannah had just said that she hadn't had a chance to look at it and might have some questions afterwards. And I've said to Hannah and to anyone else, if you want to talk about this further, very happy for you just to get in touch directly. Maybe Leanne will get my email address put onto the information that comes out at the end. Yeah.
Yep, I'll do that. Yep. So you will get the email within a few days after we upload the info session. All right. Thanks everyone for attending. Have a great day.
Thank you, everyone. Bye.
Bye.